Okay, the mini gastric bypass is an unusual position because most insurance doesn't cover it.
Right.
And so, we are very flattered and surprised, in fact, that people will come from all over the world to see me here to have me do their surgery. In many cases, their insurance would have covered for them to have a free lap band or a free, what's called the Roux-en-Y gastric bypass. And they elect, even though they could have a free one of those two surgeries, they choose to have us do the MGB. And that's very flattering, but it's also embarrassing that we have to have people take money out of their own pockets when we would prefer that their insurance paid for it. Now, it's not an unusual situation to have doctors disagree about therapy. In fact, it's really common, and around the world, if you look at it, there are always controversies about therapy. So you could go see a heart doctor, and one heart doctor might say, you take a pill. And you could go see another heart doctor, and they say you need an angioplasty. And you might see another heart doctor, a heart surgeon, and he might say you need surgery. Or if you had breast cancer, you could see one surgeon and they could say you need a lump taken out and x-ray therapy. You could see another surgeon, they say you need the breast to come off. This kind of controversy led insurance companies to be a little confused. How do we decide what therapy we support? So now there's a whole area of research that's called evidence-based medicine. And the idea there is if you're an insurance company, you're trying to make a good decision, being a good steward with the finances, but also take good care of your patients. So they've come up with this idea, how do we decide what is the best treatment? Now, evidence-based medicine looks at things this way. The best scientific research that we can get is something called a controlled, prospective, randomized trial. Okay? That's called level 1 research. And you can have opinions and this and that, but that level 1 research kind of trumps everything. All right. The MGB, I've been doing it for 12 years now. We've done 5,000 patients, and we've had now surgeons around the world doing it, and the results are good, and I believe in it. But this past August, the International Federation for Surgery of Obesity met in Paris. I had to go, it was purely work-related. And they presented 3 papers that were controlled, prospective, randomized trials. They compared the MGB to the Roux-en-Y. The MGB was better. They compared the MGB to the lap band. The MGB was better. And they compared the MGB to the new sleeve gastrectomy, and the MGB was better. Now, in one study, the MGB versus the sleeve, we can give you a grade of just how much better it is. Today we've heard about 2 failed lap bands where they had 100% failure, and now they're having an MGB. How good is the MGB in comparison, say, to one of these others? In one study where they compared the MGB to the sleeve gastrectomy, they measured the result by looking at the cure rate of diabetes. The cure rate of diabetes. The sleeve gastrectomy in the controlled prospective randomized trial cured about half the diabetics in the study, and the MGB cured about 100%. If you use that as a measure, then we would say the MGB is not just better, but twice as good by that measure as the sleeve gastrectomy. Now, what this means to insurance companies is they haven't been paying for it because there wasn't level 1 data. But now we have level 1 data, and we're working on letters and things like that. We think that in the near future, maybe 6 months to a year, that we're going to see insurance companies start to cover the MGB. So we're
not the Army or the VA.
What happens is kind of a domino effect.
I see.
If you get level 1 evidence, then what you can do is you can apply to the VA and the Army and say, look, I know you want to do a mastectomy, a total breast removal for my daughter's breast cancer. But there's level 1 evidence to say that just taking out the lump and radiation therapy is better.
Yes.
And even the government can listen to this new idea of level 1 evidence. So we are predicting that with this new data that's coming out, just as another bit of level 1 evidence, 7 years ago in Italy, They randomized 50 patients to either a lap band or the old stomach stapling, which everybody kind of says is not very good. In fact, it's been abandoned. The data from that 7-year study was just published, and the lap band was inferior to old-time stomach stapling. So if you put all that together, which we're trying to do in a letter to the insurance companies, we think we're on the threshold of being able to convince insurance companies that them paying for lap bands is actually not in the patient or their best interest, but we don't have all that done yet. But we think we're on the threshold of that. So those people that are thinking about it, we don't run down the lap band. If you want to have a lap band, we don't think it's bad, but keep my phone number.
What's the cost of a typical MGB?
The total cost is $17,000 for everything. The hospital, the anesthesia, and the doctor's fee, which we're embarrassed about.
Dr. Rutledge? Sorry. I read somewhere that if you are insulin resistant, that they know that the lap band won't work on you. And that they're trying to make them disclose that information beforehand. Because my girlfriend that had it done, she's insulin resistant. And she found that out afterwards.
In fact, there are some studies where they say that the band works for diabetes, but the problem is time. The lap band tends to work short term and then fail as time goes on. So that if you look at some studies, the band is tremendously effective if you look at 1 year. It's pretty effective at 2 years. By 5 years, about 50-50, depending on how you look at it. And in Europe, where they've had it longer than us, at the 10-year time frame, lots of the lap band doctors are giving up on the band. And so there is a growing amount of recognition that the band is not a great choice. On the other hand, in the United States, in this area, in California, it's still going gangbusters. So there are going to be zillions of people with bands. And we don't, I mean, maybe it'll work for some people. Our prediction is that all those people are going to have to see me sooner or later.
I have to tell you what this endocrinologist told my brother yesterday about the surgery and you. But he asked me, so I'm considering the surgery, and he said to him, he said, well, I would first recommend vegetables and berries, but you have failed to turn the corner. He said, so this is kind of extreme. He said, the good thing is that the benefits are like this, and because you have done so many surgeries, your risks are like this. He said he's done 5,000 of these, his risk factor is cleared down.
Right, and there's a lot of research on that. In other words, there are a lot of very good general surgeons who do gallbladder surgeries and colon and breast cancer and things like that, and also put in lap bands. And we feel like that this surgery is technically complex and difficult, but one person doing a lot of things can get really good at this one little complicated thing.
That's what he said.
Yeah.
He said he felt very good about it because he's in your hands.
Well, thank you. Can we get that on video? No. Okay. Well, thank you. Any questions that you and I should talk about? Are you taking your supplements and the creatine and all that stuff?
I take supplements every day.
Good girl.
And I did have a couple questions I didn't know.
Yeah.
Where are they? Well, I asked you about the lactose intolerance thing. Where I got that.
Well, let's talk about that for a second. Lactose intolerance. What does that mean? It means when you go to eat a dairy food that has the sugar in it called lactose, which is two sugars, a maltose and a galactose or something like that, that when you try to eat it, your body, when you're a baby, has the enzyme to break it into pieces and absorb it. And that enzyme is called lactase. And when we're babies, most of us have it, although some babies can be intolerant. As we get older, the availability of that enzyme declines, so that a lot of adults don't like milk as much as we did when we're kids. And you can get problems with that sugar. If you don't digest it, it can cause some gas and cramping, diarrhea, burping, pain, things like that. So a lot of adults drink less milk as an adult than they did when they're kids. Now, some of us are blessed and we have that lactase enzyme and we can still enjoy ice cream and milk and all kinds of dairy products, but not everyone. Now, it turns out the location of that enzyme, lactase, is in the upper part of the small bowel, and we bypass the upper small bowel. So many of our patients post-op have trouble digesting dairy products because of the lactose sugar. And so you can get trouble if you eat a lot. Usually a spoonful of ice cream is okay. But if you were to eat a whole cup of ice cream or things like that, or a whole cup of cereal with milk, sometimes you'll have trouble. There are a couple of things you can do to protect yourself. Number one, take some lactase enzyme you can buy at the grocery store. And the name of that is called Lactaid. So you can just eat some enzyme when you eat your dairy product. Another thing you can do is you could get lactose-free dairy products. So you could get lactose-free milk. You can get lactose-free ice cream, soy ice cream, or stuff like that, or sherbet, or things like that. The third thing you can do is you can eat yogurt. Now, yogurt has lactose in it, but for lactose intolerance people, they can take it because of the bugs, the lactobacillus that's in there. So yogurt, even though you're lactose intolerant, is still a good thing post-op.
I also seem to get real tired, like in the evenings, so I don't seem to have the stamina that I used to.
Salt.
And so is that salt?
Yeah, and you can test that by what we talked about, just the stand-up test. If you want to get real scientific, you can go to your doctor's office and when you're tired, stand up and have him measure your blood pressure and your pulse. Or you can do it at home by buying one of those wrist blood pressure and pulse things you can get from Walmart or Walgreens, and lay down for 5 or 10 minutes and measure your blood pressure and pulse, and then stand up quickly. If your blood pressure and pulse go down, then you're like Amy, you're not getting enough in. And many of our patients have this because they're living kind of a normal lifestyle, and you can't with an MGB. So one of my patients was a Baptist minister and an undertaker. I think that's okay. Yeah, he got him. I think it's okay. Anyways, and what he would do, he would get up in the morning and his undertaker job, he would skip breakfast, and he said people were dying to get in. Oh, never mind. Sorry. He'd be real busy. He'd skip lunch, and his normal lifestyle was he would eat a huge dinner and then fall asleep on the couch. Okay. And he tried to do that after the MGB, and he would be hungry as a bear. He'd get home and try and eat a big meal, and the MGB would make him throw up because he couldn't eat all that food. So he called me and said, something's wrong. The MGB is making me throw up all the time. And he told me the story. I said, you cannot eat that way with the MGB. You have to eat breakfast. Then an hour or two after breakfast, you have to eat again. And then you have to have lunch. And then an hour or two after lunch, you have to eat again. And if you don't do that, I will punish you. I'll come to your house, and I'll make you tired and weak, and you have to eat small, frequent feedings. You can't make up for it at the end of the day. And if you try it, you'll find the MGB is a pretty tough adversary. You don't spit in the wind. You don't tug on Superman's cape, and don't go against the MGB.
Do you take Pepto-Bismol?
I found that I take Pepto-Bismol with me when I go somewhere. I don't seem to take it on a regular basis, but if I go somewhere and I am stuck eating something like maybe at somebody's home, or I don't have a lot of choices, or at a restaurant there's not a lot of choices, it may not set well with me. So therefore I need the Pepto-Bismol. But that, I just take it as an insurance policy.
So you don't take it to prevent ulcers, then you take it for diarrhea?
Well, I took it a lot during the beginning, but I don't take it at all. No.
Right, we don't think you need it permanently. We do like it initially because the bismuth protects the lining of the stomach and kills the bad bacteria called Helicobacter pylori. And a little bit of bismuth every once in a while may be good.
Seems like it was a couple of months I took it
Right.
regularly, and after that I just kind of got off it.
Oh, okay.
We were kind of discussing the gallbladder problem. Is that a given that he will have to have his gallbladder eventually removed, or?
Did you talk to any of my patients pre-op?
We went to one in San Diego, and you mentioned the gallbladder, and I do know that for a while Nutrisystem, if you were on that, they had to stop it for a while because of the gallbladder.
Right. Well, I'll give you the story. I'll give you the story on the gallbladder. Basically, when you lose weight, you can have a change in the character of the bile and form stones.
Right, okay.
So in the early days, when I first started, lots of surgeons who were doing weight loss surgery would take out the gallbladder.
I see.
And they fussed at me. They said, Dr. Rutledge, you're wrong. The MGB is wrong. Taking out the gallbladder is wrong. Doing it laparoscopically is wrong. Using email to talk to your patients is wrong. Having a website is wrong. I mean, they just went on and on. It turns out, though, that change in the bile that forms stones can be prevented just like we can prevent the sludge that forms in your radiator during the winter. What we really need for your gallbladder is antifreeze.
Okay.
And we can get some because God in His infinite wisdom created an animal that every winter stops eating and loses a lot of weight by burning its fat. So bears hibernate every winter.
Do we have to kill the bears?
You have to sneak up on the bear,
And you don't.
while they're hibernating, stick a needle in their gallbladder, and then get the heck out of that cave.
But you don't have to kill the bear.
No, just a needle in the
Oh,
gallbladder.
okay, that's, I'd rather lose my gallbladder than kill a bear.
Yeah, well, actually, we had a member of PETA. You know PETA?
Yes.
Okay. And so one day I was talking about how you harvested these from these poor sleeping bears, and she got really angry, Dr. Rutledge, you should tell me before I use this, and I said, well, I was kidding because we actually have a big pharmaceutical company that synthesizes this. We don't go to get this from bears anymore. I'm a member of PETA.
So you're giving the person a synthesis.
Yeah, we don't actually go.
Like for-
We don't. They're not actually. That there's this TV show, World's Worst Jobs. World's Worst Job. You sneak around it in the winter.
So what about visiting with babes in their
Shh! Get me the needle. Dr. Rutledge is operating again. I need more bile. Yeah, no. It's they found the chemical and now they synthesize it in a big,
All right.
just like where they're making penicillin, stuff like that. So we can have some people get gallstones after the surgery. It's possible, but the rate is pretty low. And the key is taking that Actigol, which is also called ursodeoxycholic acid from Ursa the bear. Ursodeoxycholic acid. It's prescription, right?
Or a symptom has to come up and then you prescribe it.
What's that?
It's prescribed, or
We prescribe it.
or a symptom has to come up and you prescribe it.
No, we
Okay.
recommend everybody take it because the risk of gallstones is so common.
Okay.
And you get it in a pharmacy?
You get it from a bear.
Or what?
No, you get it from the bear.
Oh,
We know bears. We know where the bears are, and we'll tell you to go out and know. Yeah, you get it from a pharmacy.
where I live, they're right there.
There are some bears nearby. Okay, good. Where do you live?
Montana.
Okay, so there's some bears near you.
Yeah.
Okay. Have you ever snuck up on one and tried to get their gallbladder bile out?
Oh, I just stay out of
All right,
it.
it's probably a wise decision. I go to the pharmacy.
Okay, all right.
Okay, well, now we're going to switch gears just a little bit. We're going to talk to Amy. Any last questions before we let you go, so you don't have to suffer listening to me anymore? Okay, you can call me. We want to get you better, and we're sorry you're kind of tired and nauseated. Hopefully that'll get better over time. 13 pounds, though. You go, girl.
It's great metabolism.
Now, will she, if she starts this salt intake, blah, 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 is she gonna gain some of that 13 back, it being its water?
It's
rather
possible.
than-
It's tough to go back up. What we'd like to do is stabilize so that over the next couple of days she starts feeling slightly better so that by next week she's down 14 pounds in 14 days. That's more like it.
Yeah, 'cause
A
I
pound
know
a day
when
is-
When you're losing weight, 1/2 a pound just presses you,
Right. And so what we like to tell people not to focus on that because we do have people, for example, because they've been on blood pressure medicines that are diuretics or things like that, they'll call and be very tense over the 1/2 pound weight on one day or another. And what we say is, it's really a marathon, not a sprint. Yeah, and if you start looking at your toes and trying to walk across the country, you're going to fall down a lot.
Yeah.
So what we say is, put your eyes on the prize, look up a little bit. And the big picture is, for Amy, for example, is she had a lap band removed.
Yes,
She had an MGB. She didn't have infection. She didn't have bleeding. She didn't have a complication of anesthesia. She didn't have to get admitted to the ICU. Her problems are terrible. We hate them. But there are big things out there that are life and death issues, and none of those happen. And she came to us for weight loss, and we're flat doing it.
yeah. Okay.
And so we don't want her to feel bad, but on the other hand, we have now given her a very powerful, very successful tool for weight loss,
All right.
and we got her band out safely. And it's awful that she's tired and awful that she has the nausea, but maybe for the rest of her life, maybe the chance of breast cancer just went away.
I see. Okay.
And it's awful for her to feel sick. I'm not proud of the fact she feels bad.
Yeah.
But if I look a little bit further down, if she could lose 150 pounds,
Yeah.
like our patient there, if we could protect her from diabetes and heart disease and breast cancer and things like that, then maybe these couple of days are worthwhile.
Okay.
I still apologize, and I'm sorry you don't feel better. All right, call us anytime. We're around.
All right.
Okay, now what we're going to do is do some more introductions. We have people having surgery this week. Can I see your hands? Hey, guys. How are you? Good to see you. So we have mostly guys. So that means I can tell all those jokes that I'm... Oh, no, I guess not.
When surgery's over, they're still listening.
That's all right. Well, do you guys want to say hi?
Okay. Hi, I'm Marissa. I'm
Good.
from the Bay Area. I'm
Great.
26 years old, and right now I weigh 249, depending on the day.
Who's here with you?
This is my mom, Michelle.
Hey, Mama.
My support system, my rock.
How did you find out about us and end up over here seeing us?
Well, actually, a coworker of hers went to you about 3 years ago.
Mhm.
She is in premenopausal in her late 40s, early 50s, and she'd been struggling yo-yoing her whole life on everything, every fad diet, everything. And about 3 years ago, she went to you, and she's been highly successful, and we become family friends. And about a year and a half ago, we started talking about it with me because I just had serious knee surgery. I've had ankle surgery. I have hip problems, back problems. I just got diagnosed with pre-diabetic, which means if I don't change something drastic, I'm going to end up being a diabetic. My older sister is 40 years old, has 5 kids, and she is dealing with diabetes, and she's very overweight as well. So after about a year and a half of staring at your website and watching the videos and reading about all the other things that are out there and complications, and really kind of sitting down with myself and with my friends and family, we decided to make the trip out here from the Bay Area. And so, yeah.
Good. Well, we're happy to have you here. Any comments so far on this wacky clinic that we have like this? You've never been to a doctor's clinic like this before, I'm going to guess.
No, I haven't. But I got it from my mother. I'm such a researcher that literally, if I don't know something, I go on the internet and look up everything I can know about it. So going into this today, it's a lot of familiar information that I've already known. And she's a health nut and into nutrition and diet and all this kind of stuff. So she also, whenever she gets articles, comes to me too. So.
Okay. Have I said anything wrong today that I need to apologize for?
Actually, both of us are like, oh, we know this too.
We know that already. I'll tell you a story. We had a guy who was kind of like this. Now, guys act a little different than you. First of all, at the beginning of this, he was going to have surgery with me. He got up and he says, I hate you and your packet. And I think this is a bunch of BS. And he used real words.
I gotta say, I hate the packet too.
What?
I hate it with a passion.
Right. So he was like,
I turned it in. I never want to look at it again.
Well, and he said that. And then he just, and I said, well, I apologize. I hope there's a reason for it. And so he sat down. Then everybody's asking questions, a lot like we had questions here today. You could just see he was fuming. He's not saying anything.
It's all in the packet.
Well, you're a step ahead of me, because he's like, finally, he just couldn't stand it anymore. He stood up and said, "You bunch of frickin' why don't you just read the frickin' manual?" Okay.
He needs some estrogen.
Yeah.
So yeah, he was a little tense. And
but your packet basically was when Lauren said take your time, and I'm seeing when you sign up for that Yahoo MGP thing, and everybody's like, take your freaking time. I swear, I started my packet in March. And I finally just put the lead out like the last 3 weeks. So yeah, it definitely, but a lot of things are repetitive, but all the information, all the questions, if you really actually, when I read through it over and over again, she read through it, all the questions you can think of are in there.
Well, as a nurse instructor, I felt it needed a lot of editing.
Well, yeah, it did. It seemed
Guilty.
It seemed a little copy
I was
paste.
like, who wrote this?
Yeah.
Guilty.
once you get kind of over it seemed like a copy paste kind of just all this information, and it was repetitive. But besides that, it's all in there. That's the point I'm getting at.
I think you're right. And we've had actually occasional volunteers who said, for a certain amount of money, I'll edit it up for you and things like that. And I've said, sure, but when they, well, you're on. I'm just going to say, we'll give you. No, you don't have to do it for free. I mean, we'll pay for it. But once a lot, we'll pay you a lot of money.
We pay for my daughter's surgery. So
That's a lot. Yeah, but on the other hand, we'll pay for your time. And what has happened, everybody. They rightly so. They have criticism, and you say, "Fine, I'll pay your time. Figure out a number for me. Give me a, And
She's
I've had
got a master's degree. I'm a technical writer, and I'm like,
you can make some money back on your surgery.
Who wrote this?
You can make. Well, I'm seriously.
Nurses are always critical.
No, but that's right. No. Please do. We would love to have it edited, and we'll pay you for it. But when we've said that a bunch of times, people get into it, and then they get off on their own thing. I have never had anybody actually follow through. But it's an open invitation. If you guys want to work on it, we'll pay you for your time. Okay?
We can try.
Yeah, sure.
we're looking for the original Word documents too.
I've got it. Sure. And the whole thing needs to be.
Your mom's going to be for you. That's excellent. I said something to my brother this morning. I lost a lot of weight by just Weight Watchers, and he bought my motel. He has a great room over there at the Comfort Inn, and they have this huge breakfast. They had sausage and eggs and stuff. I sat down, had my Cheerios and my sugar-free stuff, and I said, Claude, I want to tell you this. This is important to me. It doesn't matter how you lose this weight. Whether you have to give up Coca-Cola or Mountain Dew, I don't care how you lose weight. You have to watch what you eat your whole life. I don't care who you are.
Yeah.
You can't just go out and eat anything you want. You're a normal weighted person. I mean, you have to, whether you're taking your Pepto-Bismol or you can't take the side effects, there's restrictions to maintaining the life you want. I don't care who you are.
True.
And don't be missing it, because I know he's a little bugged by this, and you're right, you can't take Tylenol, you can't take aspirin, I can't eat hot dogs. I mean, there's things I can't eat anymore if I want to be comfortable with myself.
Well, and if you think about, is there anything in life that's just a total free lunch? Is there anything in life where you could say, gee, this surgery, this medicine, is just perfect? It's nothing but, a little fairy arrives and touches you with a wand, and you get the Cinderella effect. That's not the deal. This is very powerful. We're talking about life and death. We're talking about 20 years of extra life in some people, maybe not getting breast cancer, not having a heart attack. I mean, it's really big stuff. But along with that goes something. If you take an aspirin tablet, you can get bleeding. If you have the MGB, you can get a bleeding ulcer. It's the deal. And there's always a deal. And that's back to why we put you through the packet. We know of patients who see a doctor for 20 or 30 minutes, get scheduled, and get a lap band, and they really don't know the details of the risks and benefits. We ask a lot from our patients, and we're very proud of that demand, because you guys have really gone through a training and educational process that's way above and beyond what the average weight loss surgery patient is. On the other hand, we think you're going to be better for it, as painful and unpleasant as it is.
Well, you're psychologically better off, for sure.
Well, there's good research on that. They looked at people just having pain for the surgery. And the more people knew, the more educated they were, the less pain they had. They're just less frightened. So it makes a difference. And again, you saw patients from last week with their staples coming out. You can see them talking. You can see, well, here's somebody who had some nausea. She wasn't doing perfect. That will make you have a better experience.
To say something to that, I have unrealistic anxiety about surgery. I've had serious surgery on my leg, on my knee, like full ACL, MCL, lateral meniscus. I've had, as you said earlier, I had pins and plates in my ankle. I've had some crazy surgeries where before they will dope me up on Valium, on anything, and I'm still hysterically crying and shaking. I have such unrealistic anxiety before surgery that my doctors, numerous times, go, wow, like blown away by it. And this whole thing, seeing this, like I got a little teary-eyed seeing that, because I still have anxiety with it, but seeing it up close and personal and knowing so much beforehand, it has calmed me a lot.
Well, and you have never had my anesthesia. So,
38 minutes.
His name is Mike Tyson, real quick.
well, what I'd like to, it's